Dr. Bush, let me ask you something straight. How often do people ignore their kidneys until it's too late?
Far too often, Dr. Sticks. Most people don't realize that kidney problems creep in silently. By the time they feel the pain, the damage is already advanced.
Exactly. Today, we're going to break down the 10 symptoms that scream your kidneys are in trouble, even before you miss a beat or a lab test.
Let's start with one of the most common but overlooked signs: changes in urination. People notice their urine is foamy, bubbly, or more frequent, and they shrug it off.
Right. And sometimes it's the opposite, less frequent urination. Your kidneys are the body's filter. When they're failing, they can't process fluids properly. Even subtle shifts matter.
And don't forget color changes. Dark brown or reddish urine is a big red flag. Most people think it's dehydration, but it could be blood from kidney damage.
Symptom number 2, swelling. Puffy ankles, swollen hands, even around the eyes in the morning. That's your kidneys failing to remove extra salt and water.
Exactly. Many patients blame it on standing too long or high sodium diets, but persistent edema, especially when combined with other symptoms, should never be ignored.
And it's subtle at first. Morning puffiness can come and go, but it's a warning sign. Kidneys aren't just about filtration, they maintain fluid balance in your body.
Symptom 3, fatigue and weakness. A lot of people assume exhaustion is from work or stress, but here's the kicker. Kidneys produce a hormone called erythropoietin that stimulates red blood cell production.
Without it, fewer red blood cells carry oxygen, and your energy tanks. Persistent fatigue, brain fog, or even dizziness can point to kidney dysfunction.
It's often dismissed, which is dangerous. I've seen otherwise healthy patients assume they're just overworked while kidney function was dropping.
Number 4, shortness of breath. At first glance, people think it's the lungs or heart, but fluid buildup from failing kidneys can pool in the lungs.
Exactly. Pulmonary edema. You get that heavy, tight chest feeling, sometimes even waking up gasping at night. That's your kidneys sending out distress signals.
And here's the trick. This can happen even without coughing or other classic lung symptoms. If it's paired with swelling and fatigue, kidney checks are urgent.
Symptom 5, persistent nausea and vomiting. Many patients think it's food poisoning or stress, but uremia, buildup of waste products in the blood due to kidney dysfunction, triggers this.
And loss of appetite, too. People chalk it up to just not feeling hungry, but combined with other signs, it's a serious warning. Kidneys failing silently affects digestion and metabolism.
Exactly. Early detection can reverse or slow damage, but ignoring these subtle gastrointestinal signals costs precious time.
Symptom 6, metallic taste in the mouth or ammonia-like breath. Patients sometimes complain that meat tastes off, or they notice a chronic bad taste.
That's uremic toxins accumulating. Your kidneys aren't filtering correctly, so your blood chemistry shifts. It might seem minor, but it's a consistent early sign.
I tell patients, if brushing your teeth doesn't fix it, your kidneys might be behind it. It's subtle but telling.
Symptom 7, muscle cramps and twitches. Electrolytes, sodium, potassium, calcium, get imbalanced when kidneys aren't working.
Exactly. Those annoying nighttime leg cramps or sudden hand twitches could be your kidneys struggling to maintain electrolyte balance, often ignored because people think it's just dehydration or age.
But when paired with fatigue, swelling, and urination changes, it forms a pattern you can't ignore.
Symptom 8, high blood pressure. It's no coincidence that 1 in 5 hypertensive patients also have kidney issues.
Right. Kidneys regulate blood pressure through fluid balance and hormones. When damaged, they can't control it effectively. Unexplained hypertension can be an early marker.
Many assume they just need lifestyle tweaks, but resistant or sudden high blood pressure should trigger a kidney evaluation.
Symptom 9, trouble sleeping. Insomnia or restless legs can emerge from toxin accumulation and electrolyte imbalances.
Yes, restless leg syndrome is surprisingly common in chronic kidney patients. It's frustrating, often misdiagnosed, but combined with fatigue, it points directly to renal issues.
Even mild sleep disruption, when chronic, warrants a checkup if other symptoms are present.
Finally, symptom 10, skin changes. Dry, itchy skin, even rashes. Waste products accumulating under the skin irritate nerves and tissues.
Patients often think it's eczema or allergies, but persistent itching that doesn't respond to creams paired with fatigue or swelling screams kidney trouble.
And this is often one of the first outward signs people notice outside the lab tests. Don't ignore skin signals.
So to summarize, we're looking at urination changes, swelling, fatigue, shortness of breath, nausea, metallic taste, muscle cramps, high blood pressure, sleep issues, and skin changes.
Right. 10 warning signs that don't wait for labs to get worse. Ignoring them is a risk you don't need to take.
Early detection is everything. Blood tests, urine analysis, and imaging can confirm kidney function. The sooner you act, the better the outcome.
And lifestyle matters too. Hydration, controlled blood pressure, avoiding nephrotoxic medications unnecessarily. Prevention can save kidneys from irreversible damage.
Even small changes, cutting processed foods, maintaining weight, managing diabetes or hypertension can make a huge difference.
One more point, education. Many patients think kidneys are silent organs. They only show up in severe illness. That's false. Listen to your body.
Exactly. These 10 symptoms are signals, not suggestions. Early consultation with a nephrologist can prevent progression.
So if you catch yourself with any of these signs, don't wait. Book tests, talk to a professional, and take control.
Kidney health is silent but vital. Respect it. Detect early, act early, and protect your life's most crucial filters.
That's right. 10 symptoms, 1 urgent message. Pay attention, act fast, and don't underestimate your kidneys.
Absolutely. Prevention today saves a lifetime tomorrow.
Before we close, Dr. Bush, I want to share a real patient story that many people can relate to. A 42-year-old man came into the clinic complaining about constant tiredness. He said he felt exhausted every morning, even after a full night's sleep.
I remember cases like that. Many patients assume it's just stress or overworking. What else did he report?
He mentioned 2 things that caught my attention immediately. First, he said his ankles were slightly swollen in the evenings. Second, he noticed that his urine had become unusually foamy.
Those are classic early signals. Swelling and foamy urine together often suggest the kidneys may be leaking protein.
Exactly. But here's the part that made his story very relatable. He ignored those symptoms for almost 6 months. He kept saying, "I just need more rest."
That's the mistake many people make. The body whispers before it screams.
So we ran some simple tests, blood work and a urine analysis. The results showed early-stage kidney disease. Thankfully, it was caught before serious damage occurred.
And that's the key lesson here. Because it was detected early, the treatment plan was simple. Control his blood pressure, improve hydration, reduce processed foods, and monitor kidney function regularly.
Within months, his swelling improved and his energy levels came back. His kidneys stabilized because he acted before the condition progressed.
That story highlights something powerful. Kidney disease rarely appears suddenly. It sends warning signs first. The problem is that most people dismiss those signals.
So if anyone watching notices fatigue, swelling, unusual urine changes, persistent nausea, or unexplained itching, don't brush it off.
Listen to your body. Early testing could make the difference between simple treatment and lifelong dialysis.
Exactly. Awareness is protection.
And protecting your kidneys means protecting your life.